Warning: politicizing science puts lives at risk. Imagine a future where the next pandemic spreads unchecked, and Americans are left vulnerable to diseases that could have been prevented. This ominous scenario is becoming increasingly likely, thanks to Robert F. Kennedy Jr.'s recent decision to scrap nearly $500 million in contracts for mRNA vaccine development projects. As the Health and Human Services Secretary, his actions not only undermine trust in existing immunizations, but also jeopardize the nation's ability to combat future health crises. The unseen consequences of anti-vaccine ideology. Kennedy's disparagement of mRNA technology is particularly alarming, as it may convince people to forego recommended vaccinations, eroding herd immunity, and leaving the population exposed to diseases. But there's more at stake. By cutting short these innovative projects, we risk missing out on life-saving solutions for diseases that public health officials won't be equipped to fight. Debunking the myth: mRNA technology's proven track record. Contrary to Kennedy's baseless claims, mRNA technology has a stellar record. It enabled the rapid development of effective COVID-19 vaccines during President Donald Trump's first term, a feat that would have been unthinkable just a few years prior. Operation Warp Speed's urgency catalyzed a remarkable vaccination rollout, bolstering the population's immunity at a critical juncture. Although, like any medical treatment, these vaccines weren't perfect, with rare instances of myocarditis in adolescents and waning effectiveness over time as the coronavirus mutated, they undoubtedly saved millions of lives. Setting the record straight: mRNA vaccines' effectiveness. Kennedy's assertions that mRNA vaccines are ineffective against upper respiratory tract viruses and that a single mutation can render them useless are patently false. The COVID-19 pandemic demonstrated that while mRNA vaccines' effectiveness against infection may diminish over time, they continue to protect against severe illness across multiple strains. The Centers for Disease Control and Prevention, CDC, recommended these shots for vulnerable populations, and manufacturers updated boosters to combat new strains. The far-reaching consequences of abandoning mRNA technology. By canceling 22 mRNA projects supported by the Biomedical Advanced Research and Development Authority, Kennedy is not only hindering scientific innovation, but also leaving Americans more susceptible to diseases. The axed projects include a crucial vaccine development for the H5N1 bird flu virus, which experts warn could spiral into a deadly pandemic if not addressed. Furthermore, researchers are eager to leverage mRNA technology against a range of formidable pathogens, from hepatitis C and HIV to malaria, as well as to combat cancer cells and treat genetic diseases. Some scientists even suggest that this research could be vital for national security, helping to defend against biological weapon attacks. A call to action: don't let science fall prey to politics. Labeling Kennedy's actions as short-sighted barely scratches the surface of the harm inflicted by his rejection of science. As Americans, we will bear the brunt of this decision. We must ask ourselves, are we willing to sacrifice progress in the name of ideology? Can we afford to overlook the proven potential of mRNA technology in the face of emerging health threats? What will be the true cost of politicizing science, and who will ultimately pay the price? Share your thoughts. Do you agree that mRNA technology holds the key to combating future pandemics, or do you think the risks outweigh the benefits? Join the conversation and let us know in the comments.